Hi, everyone. My name is Khadija, and I'm one of the OB-GYN Junior Clinical Fellows in NHS. I currently work at King's College Hospital, and I've been working in this position for about 2 years. So today we're going to talk about what working in OB-GYN within the NHS is like, what are the skills you need, what you can expect on a new job, and what might help you thrive in an NHS setting. So I will start by giving you a bit of info about my background. I graduated from Pakistan and I did my foundation year training, which is usually 1 year in Pakistan. I did an OB-GYN rotation, which was about 3 months. And after that, I worked in a local hospital in a position where I rotated between different specialties. And then I got my first job in the NHS in 2023, which was the one that I'm working in now. So I have always enjoyed working in OB-GYN. The main motivating factor for me behind this is the surgical experience and the fact that you work so closely with women in this specialty. And NHS felt like just the natural next step because I didn't enjoy working in OB-GYN in Pakistan, but the environment wasn't really one that you could thrive in. But the NHS fit my motivation and my goals quite a lot better, so I decided to move to the UK. So coming to the subject, we're going to start by talking about how the gynecology ward in an NHS is structured. So there's a few different areas in every gynecology unit. Every ward has a labor ward, a separate maternity ward, which will have antenatal and postnatal patients. There is a separate area called triage, which is basically an assessment unit where any patients who have any urgent queries regarding their antenatal health, they can just come in. This could be somebody with vaginal bleeding, this could be someone with abdominal pain, somebody who's had infection, or even postnatal presentations such as infections or endometritis. You see all of this stuff here. So they're able to access this service at any point, at any time. This is a 24-hour service. And then we treat the acute issues when they arrive. There is a separate birth center in most units, which is midwifery-led. So this is where the most low-risk patients will come to deliver in a hospital environment. Then every labor ward or every gynecology ward has its own theaters, which are exclusive for OB-GYN. This is where we do all of the C-sections, all of the perineal repairs, or if there's any operative deliveries that need to be done. Then every ward has an induction bay. This is where the patients who have opted for induction will be admitted and they will start the induction process. Then every unit has a handover room, a dedicated handover room where all of the teams on call, who are there for on-call handover at the start and end of their shifts. And then there's lots of offices in every ward. This could be the admin offices, this could be the doctor's offices, the midwives, the research midwives. So all of these offices are also located on the same unit. And every maternity unit also has an accompanying neonatal unit. This can be of different levels depending on the hospital. This could either be a special care baby unit, it could be a level 2 or level 3 neonatal unit, depending on the hospital you're working in and how skilled their staff is. Sorry. Right, so coming to gynecology, most of the gynecology patients will be on surgical wards. Some places have a dedicated women's surgical ward where they admit their gynecology patients. And gynecology wards are usually located closer to the main theaters, which is where most of the gynecological procedures take place. Then there's the day surgery, where patients have minor surgical procedures that can be done within a day and they're discharged the same day. Some day surgery units also have wards where the patients can stay over for the night if needed. Or if somebody we're expected to discharge the next morning, they can stay over in the day surgery unit for the night. Then there's the A&E, which will send you referrals. So you will spend a lot of your time as the gynecology SHO dealing with emergency referrals, emergency admissions, and just coordinating with the emergency staff and doctors. The team usually has a consultant. Then there's 2 registrars. In some places, there's just 1 registrar. In my hospital or the hospitals that I have had exposure to have 2 registrars. There's a senior registrar who's looking after both gynecology and obstetrics, and they're basically leading the team after the consultant. Then there's a junior registrar who mainly looks after the labor ward. And then there's house officers. In the daytime, there's 2 house officers, one covering gynecology and one covering the obstetrics. But at night, usually there's just one house officer who's looking after both obs and gynae. Then there are the midwives. There's a midwife in charge who's coordinating the team on labor ward. There can be quite a few in charge for different areas. There's a separate in charge for the maternity assessment unit, separate in charge for the maternity ward, and a separate in charge for the labor ward. So they're going to be your go-to people if you need anything on the maternity ward. And they're the people who coordinate with the registrars and consultants regarding patient management and planning, and beds, and basically the flow of the ward. You're also going to be working with a lot of junior midwives who are looking after the patients directly. They might ask you for different things like prescriptions, assessments, or if they have any concerns about a patient. Then on the gynecology ward, you'll mainly be dealing with nurses. They can be senior nurses who are the in charges of the ward. They might bleep you to escalate some issues or ask for an assessment. Then there's junior nurses who are looking directly after patients and they might bring some issues to you. Then you will be working with A&E doctors who are going to send you different referrals, who are going to liaise with you and coordinate with you about any urgent assessments or patients who come in either majors with acute complications or in resus after blood loss or any immediate life-threatening emergency. Then there's the admin staff that you will be working with. They're going to be the people who deal with workplace issues like HR, or there's people who are booking patients for appointments. So you're going to be dealing with them as well. Then there's subspecialties within gynecology. In my workplace, there isn't a lot of subspecialty focus, but in other places, like Denmark Hill, which is the main King's campus, they have lots of subspecialty doctors, some clinical research fellows as well. So you're going to be coordinating with them when providing care on the ward. And then there's other specialty teams such as anesthetic, neonatology. You're going to be closely coordinating with them for either arranging theaters or for procedures or for deliveries. So these are going to be your main contact points. Right. Coming to the skills that you need for working in gynecology, this includes skills that you might need to exhibit when you're filling out the application. You need some gynecology exposure. You don't necessarily need to have gynecology training, as long as you've had some reasonable level of exposure where you're able to do some gynecology jobs. For example, in my foundation training, I did have experience in delivering simple vaginal deliveries. We did do some perineal repairs. I could assist C-sections, and I had some experience in doing C-sections. So I had a very basic level of experience, but that was what was needed to work in a gynecology ward. The rest you will learn once you arrive. You learn about the system, you learn about what skills are needed, and you gain further skills as you go along. Now, another thing that that basically needs understanding is prescribing in obstetrics. This can be tricky for somebody who's never worked in obstetrics because there's lots of medication that you cannot use that can have potentially dangerous consequences for the mother or for the baby. Usually trusts have their own guidelines, so this is where you're covered by the NHS, but you need to show some awareness of this as well. Communication needs to be very strong within obs and gynae because this is a specialty where you're always going to be short on time. You're going to be dealing with multiple urgent situations all throughout your shift, and you need to coordinate with a number of staff who might have the same level of experience as you, might not. They might be looking at things from a different perspective, from their specialty perspective, and you might be talking to women who are actively in labor, in pain, who can be very distressed. So you need to have very strong communication skills. And you might end up having some conversations in very emotionally charged situations. For example, if somebody's had a miscarriage or somebody's been diagnosed with a gynecological malignancy, then you need to approach these situations very sensitively. So you need to have good communication. For team working, because in the UK, the maternity service is structured a bit different from what we had been exposed to in our country. For example, in Pakistan, we did not have an established midwifery team. We used to have one or two midwives, a few nurses here and there, but that was about it. We were doing the main bulk of the work, which included vaginal deliveries and C-sections, antenatal care, postnatal care. All of these were doctors' jobs. But in the UK, it's a bit different. Most of the regular jobs on a maternity ward, they are midwifery responsibilities. So they will be looking after the patients. They will be administering any medication. They will be the immediate point of contact for patients. And they do most of the usual vaginal deliveries. They can examine patients. They can do perineal repair. So most of the regular jobs they can take care of. What this creates is a lot of friction between teams. Sometimes there can be situations where you might come face to face with a midwife who disagrees with your decision, or you might have to explain yourself a little better. So you need to have those team working skills needed to navigate such a delicate balance. In terms of practical skills, you do need to have some skills which they expect a foundation doctor to have. I'm talking as an SHO in the NHS. So for this level of job, you need to know how to do speculum exams, how to do an accurate abdominal examination, how to do a vaginal examination. You should have a basic know-how what gynecological presentations look like. You should be able to accurately, or at least be able to formulate a good differential after assessment of a patient, after doing vaginal examination, and know when they need swabs, when they need a certain investigation done, and you can escalate appropriately to the right person. You need to have good note keeping skills. Obs-GYN is known to be very, very litigious specialty. So you need to be careful about what you're putting in the documents. You need to make sure that you accurately record your interactions. And basically, this is what is going to save you in case there's any complaints or if there's any issues that arise. Right. On an average day in OBS-GYN, this is what it looks like. We start at handover. So my workplace starts at 7. So at 7, the midwives, the doctors from the night team, the doctors taking over for the day team, everybody gathers in the handover room and we go over all of the patients. We start with the handover of labor ward patients, all of the patients who are laboring and admitted. And this is led by the midwife in charge who's looking after all of these patients, who escalates different issues. And if there's any medical input, then the registrar or the consultant can comment. After this, we move on to the other patients that we have admitted. This includes the patients who are on antenatal list, or if they have any significant postnatal complications that need to be seen on the ward. We go over those lists with just our medical team, just the doctors, and we go over the gynecology handover, which is exclusively dealt by the doctors. Then we proceed with ward rounds. For the labor ward, we start the ward round with the midwives, and for the midwife in charge. And for gynecology, there's usually a separate consultant in the daytime, and the gynecology team usually has a consultant and an SHO, no registrar. Then there are theaters. For example, if you're on labor ward, there might be some C-sections that you need to assist. Or if you're in gynecology, there might be some overnight admissions who require surgical procedures on the emergency theater, which is called the C-port theater. This is what you might need to do. And then there's clinics. If, let's say, you're on a regular day, then you might be allocated to one of the clinics. As a house officer, you're only shadowing these clinics. So you just go there for experience, for exposure. But as a registrar, you have to run a certain number of clinics. This can be gynecology clinic, early pregnancy unit, antenatal clinics, fertility clinics. There's endometriosis clinics as well. And then there's pessary clinics. So there's all sorts of clinics basically covering the entire breadth of obs-GYN, depending on what sort of facilities the hospital have and what sort of subspecialties the hospital has. Then there's different referrals, or there's patient in triage who you have to see. If you're on the gynae on call that day, then you're going to be spending most of your time in A&E seeing these referrals. And if you're on labor ward, you might assist the doctors who are working in triage if there's lots of patients. Then there's lots of meetings that happen, especially during break time. This could be educational meetings. This can be validation meetings where they basically go over patients to decide whether or not they need treatment or whether there's something else more suitable for this patient that can be done. You can attend these meetings. These are good. Basically, they provide you a good exposure to what you do outside of your work hours. You could learn about different gynecological oncology patients. You could learn about the patients who have been put on a certain pathway for surgeries. So it's really good exposure to join these meetings. Then there's a CTG meeting that we have every week where we go over any complex CTGs or any case where there's any difficult decision making. So this is a really good learning exercise when you discuss it with the whole team. Then there's different teaching meetings. We used to have teaching meetings during the break time, but that was difficult for a lot of doctors to join, especially if they were in between allocations, in between clinics, or they were just on call. So now what we do is we have dedicated teaching days where a morning or an afternoon is basically slotted in our rota, and we go and attend the teaching on in any lecture theater or any other place on the ward. So this has proven to be more effective in our case. So a lot of people will, or a lot of you will start in different places in the NHS. Some of you might start as observers. Some of you might start as junior doctors in the NHS, in Obs and Gynae. I'm going to now address what are the things you need to do when you start working in the NHS. So the first thing when you come and join either as an observer or as a junior doctor is to not just observe, not just watch around, sit around, basically be an active participant. When you're shadowing, this is what you need to do as well. You're not just there to see what's going on. You need to actively participate, actively engage with the team. A lot of observers I've seen doing is that they will sit with us in the office, they will not participate in any discussion, they will not show up on the labor ward, and this basically goes against them. Then there's other observers who come for handover at 7 a.m. They will be with us for the entire ward round. They discuss with the consultant, they give their opinion sometimes, and they want to do what we do. They want to document for us. They want to talk to different specialty teams for us. They are just around the labor ward helping people out. And these people tend to leave a very good impression. And these are the people who might get offers once a job comes up. You have to basically make yourself visible. You have to show that you have the ability, you have the knowledge, and you have the enthusiasm to learn, integrate, and that you really want to start working in this department. You have to show them this. And if you're a junior doctor who's just started, you're in your shadowing period, then you want to do the same things. Show up for handover so you understand what working in the team is like, what their considerations are, what their priorities are. The more time you spend with them, the more they get to know you, the more you get to know the system, the more get to know what your job is. If your hospital has an IT system or if there's a proper protocol that they follow for documentation, you can start learning that with the SHO. Just help them out. They wouldn't say no, they will appreciate it. If there's any jobs that need to be done, if you're the junior clinical fellow, then you're allowed to provide clinical care. So you can take an active part while you're shadowing to get a hang of things. So this is, I think, important if you're starting in the NHS. Then coming to the training opportunities within Obs and Gynae, there are lots of fellowships, although it is harder to get fellowships as a non-training doctor, but nevertheless, there's some fellowships that you can get, especially locally. For example, in my workplace, there's an early pregnancy unit fellowship that usually goes to non-training doctors. So there are opportunities, you just have to look out for them. Then there's on-the-job learning. There are lots of consultants who have specialty interests or who have done subspecialization. You can speak to them, you can ask to shadow them, you can start working in clinics with them. So this is how you learn on the job. You can also learn scanning. There's a lot of people who want to do scanning in my hospital. So what they do is they go and shadow those clinics. They ask the consultant if they can scan, and the consultant supervise. So this gives them on-the-job experience. Then another thing important in the NHS is building relationships. So when you're working with people, you need to actively work on building a good working relationship with them. And this can take you a lot further than just being in a training position. So how I would do this, as an example, what I would do is if, let's say I'm working within King's, I'm working at a different site, I'm working at the Brew, and if I were to do some shifts at Denmark Hill, I will try to develop relationship with the team there, or just speak to other subspecialty doctors in specialties that I'm interested in. For example, if somebody's doing robotics, I might, and I'm working with them, then I'm going to ask them about their work. I'm going to ask them if I can shadow any of their theatre lists. So that is going to help me build relationships. So eventually, if I decide to do robotics, I know one person who might be able to give me an opportunity. Then there's thriving in the NHS, especially as a junior clinical fellow. One of the first things that we do, especially when you're coming from a country like Pakistan, where the structure is very different, we don't normally check in with our teams. So when you're working in a certain area, you've been working all day, you've done the work, you've been putting all of your effort into it, but the team is not able to see it unless you actively tell them. So what I used to do when I started working in this job was, in the middle of the day, like around 1 or 2 p.m., I would just go and speak with the consultant, give them an update about the patients, what's going on with each patient, how many discharges we've done, if there's any admissions, if there's anybody waiting. And you do the same with the senior registrar, just so they know that some things have been done, what is left, and if you need any support, they can provide you some support at that point. And this basically leaves a good impression that you have been active, that you have been working all day, and they really appreciate that. Then there's organization and prioritization. Now, NHS is a system where there's lots of staffing issues. On most occasions, you will have just 2 or 3 doctors covering a certain area. Sometimes you might find yourself alone in a certain area. For example, if you're doing postnatal ward, or if you're on the night shifts and you're the only SHO there. In this case, you need to have good organization and prioritization skills. You need to be able to organize your tasks. For example, if there are certain tasks that should be done earlier in the day just to make things easier for you and for the team, then you should aim to do them early on. Then there's prioritization. For example, if there's conflicting demands, if you're required in the triage, if you're required on the antenatal ward, if there's a discharge summary that's pending, and then there's a theatre case that's almost ready, then you need to prioritize what to do first. You need to see if there's anything that you can immediately do while the patient is getting ready in theatre, then attend the theatres for the procedure. Then afterwards, you can deal with the rest of the jobs that are not time sensitive, that are not life threatening. So you can take on, you have to show these skills as well. You do develop them on the job, but it's good to have some level of awareness about these considerations. Then in order to learn on an NHS ward, you have to be proactive. You have to show some of your skills, and you have to explicitly tell people that you want to learn. So the culture here is that people are not going to bother you if you don't show your enthusiasm. For example, if you're not fussed about C-section lists, if you're not taking a lot of interest, or they just interpret your shyness as disinterest, then you might lose on a lot of opportunities. So what you want to do in this case is, if you're a junior, just talk to your senior at the beginning of the shift, what you want to do, talk to them about developing your skills or what you're interested in, and they will be more than happy to let you do those things. For example, I really wanted to learn to do C-section. So when I just started this job, I spoke to a few seniors who had very good surgical skills, and I started talking to them about doing some C-section, whether they could teach me, whether they could show me some good surgical skills that a good surgeon should know, and that basically helped me develop confidence. And they were very keen to teach me, and I learned a lot from all of them. Ultimately, I did go on to do C-sections, and now I'm at a point where even the consultants are confident in my ability. Then you need to take on some additional roles. There's lots of opportunities available to develop yourself professionally outside of just the usual clinical roles. This can include taking on the rota role. You can help the rota consultant with managing the rota. What this does is, this shows that you have leadership ability, that you have team working ability. So all of this can show up as really good on your CV. Then there's other additional roles. For example, somebody can be a teaching coordinator, or somebody can organize different meetings. So all of these roles basically help you establish yourself within the department, and also give you extra points for your CV, or if you want to apply for any certain fellowships. For example, they've just created this new role in my department where there's one foundation doctor who's allocated to gynecological oncology. Now, this doctor is going to help coordinate MDTs, look after any investigations or any pending meetings for any of our gynae oncology patients. They're going to assist the consultant. How they can build upon this experience is that in the future, if there's any clinical fellow role in gynae oncology, if there's any competitive fellowship, and they show that they have worked in this specialty, they have worked with a dedicated consultant in a dedicated role, then this might actually help them get that job and ultimately get them the experience that they want. Sometimes you have to go the extra mile to get what you want, especially when you're just starting out. We come here with the impression that NHS is a lot more forgiving system, but frankly speaking, it's not. It's a lot more demanding. And here, people are not as outwardly, well, I mean, I don't want to use the word, but outwardly they will be nice to you, but um, they might just carry a very negative impression of you. And this might be because you're not being proactive, or you're not going the extra mile that they expect you to. So show that you're dedicated to the job, show up for work on time, take care of your patients, remember all of the details, try to get the jobs done on time. This basically shows that you're willing to work hard, that you're dedicated to the job, and you actually want to succeed. And so people are going to be a lot more cooperative with you. They're going to signpost you to different opportunities. They might help you with further development, and you won't have any issues within the workplace. For example, if people trust you, if they see you as a reliable team member, then they would want you to stay around. And this way you would not end up struggling looking for another job in another year. Then another important thing that we tend to forget, especially when we start a new job, is that we can really get distracted from our goals. But it's important to remember that let's say most NHS positions, you get 6 month or 1 year contract, right? You have to make the most of this. So you have to work on any opportunities that are available, anything that you want to do. For example, if you have any portfolio requirements like audits, teachings, a certain course, then you might want to start looking for those opportunities as quickly as possible, so that by the time the application windows open up, you are ready to apply and you have everything sorted. So it's important to stay focused on your goal while you're doing all of these things, while you're settling in a new department. It is a lot of work, but I think if you give a year or so or slightly more, then you should be able to build a good portfolio for any future training position. Um, Right. And in terms of career development, what I can advise you is that when you join an NHS department, your first priority should be to get an education supervisor if they haven't already allocated you one, and make sure that you regularly check in with them. How I do it is I have an education supervisor meeting every month. This basically keeps I basically get the opportunity to discuss any feedback that they've received, anything that I need to reflect on, or if there's any area that I might be struggling with, or if there's any special experience that I require. So they can really help with that. Then if you need to develop any necessary skills, again, it's important to highlight to the team that you're working with. It's also important to highlight with your education supervisor, this is the experience I'm looking for. These are the skills I need to develop. And they should be able to help you out with it, because even in non-training grade, you still have basically you are entitled to all opportunities that are available to training doctors, although sometimes the distribution can be a bit tricky, because they have to balance these with the demands of the trainee doctors, then foundation doctors, and on most OBs-GYN there's GP trainees as well, so they have to find a balance. Then there is the RCOG portfolio, and for anybody working in OBs-GYN who wants a long-term career in OBs-GYN, it's important to have one, because this allows you to log cases and any CBDs cases, or basically all of the skills that you have, you can log them here, and this will be your evidence for any training position, any other development position. So it's really good to have, and you should regularly log this. A consultant that I work with told me you should aim to do at least 2 to 3 CBDs um, every on call that you work. You should be able to log at least one case, and you should also focus on uh, non-operative training skills. This can be either presenting any theatre list or just managing the labor ward. Then there's everybody's allocated to a study budget, which you have to use wisely. So there's lots of training opportunities that the RCOG offers. Then there's other institutions that offer different trainings. So you need to find out those opportunities and apply as early as possible to secure a spot. Um, a lot of places are very generous with their study budget. For example, I get around £750. So this is very useful. At least I can get one course every year that is fully paid for to advance in my career. Then there's on-the-job training opportunity. For example, if you have one consultant who's really good at scanning, and you can ask for them, you can ask to shadow them, you can ask to do clinics with them, you can just speak to them about developing a certain skill, and they might be able to signpost you to different opportunities, different trainings coming up, or even help you secure a fellowship position. Then there's building relationship with the rota team. Now, this is important if you have certain training requirements, if you want to work in a certain area more, then it's important to be on good terms with them. You can work with them flexibly. You can cover some shifts that they would really like you to. In return, you can ask to be given any clinics that you're interested in. And it basically helps to have a good relationship with them, because then they can look after you and you can look after them. Um, From my perspective, from what I've learned so far working in the NHS, the keys to success is learning from others. There's lots of people around you who have different levels of experience, and it's important that you uh, learn from them as much as you can. Another thing that I used to do initially was to read documentation, either from the consultants or from the registrars. This basically helped me learn how to write up notes, how to document different things. Then always follow up on your tasks, and take responsibility for different tasks on the ward or different things like taking on additional roles, and always be flexible. Flexibility is really appreciated within the NHS.